The newest numbers for 2021 show fentanyl has become the leading cause of death for ages 18 to 45. CDC data now shows it killed nearly twice as many people as COVID, car accidents, cancer, and suicide. Dan Grossman explores what experts say must change.
People on the wall are folks that we served or people that we know that were loved that died of a preventable overdose.
You've likely heard the phrase, the face of addiction. For some of these faces, that is true. For many, it is not.
That is our why. Dead drug users do not have the opportunity for recovery, and when people are alive, there's hope. When they're on the wall, there's no more hope.
Lisa Rayville is the executive director of the Harm Reduction Center in Denver. In just the last week, she has added 8 new faces to this wall, several of them because of fentanyl.
We are in the worst overdose crisis we've ever been in the United States. In a magical world, there'd be no drugs, but we live here.
Last year, fentanyl claimed the lives of 40,010 Americans ages 18 to 45, more than car accidents, suicide, COVID, and cancer. It is a meteoric rise in danger and one that has landed squarely in the hands of drug dealers.
What is driving these behaviors in the illicit market is clearly just profit. Is greediness.
Dr. Nora Volkoff is the director of the National Institute on Drug Abuse. Because fentanyl is so much cheaper than heroin and nearly 50 times as potent, dealers are using it to cut their drugs so they can stretch them further, regardless of potential harm. The National Institute on Drug Abuse says last year, 75% of cocaine overdose deaths were mixed use with fentanyl. The same goes with 50% of methamphetamine overdose deaths.
We have public health evidence-based interventions that we can be doing today for a healthier and safer community. For example, when we talk about prevention, we need to talk about harm reduction and realistic education to teens.
As Lisa said, in a perfect world, drugs wouldn't exist, but they do. And that's where she and Dr. Volkoff agree solving the overdose issue is different than addressing the drug use issue. They say improving things like education about contaminated drugs, addiction help, naloxone access, and drug testing strip access are all vital. If people are going to use drugs, mitigating harm is imperative.
If they are going to be taking a drug that has fentanyl, how to use the drugs in ways that are going to minimize the risk. And that includes, for example, never taking these drugs alone. Why? Because if you take these drugs alone and you overdose, no one can give you the naloxone.
Otherwise, things like this wall will only grow larger by the day. I'm Dan Grossman.